Have you heard about Ginger Z's new book about mental health awareness? It's getting a lot of attention. So this morning, we are joined by Marlene Schillinger, founding member of the Erie County Anti-Stigma Coalition and CEO of Jewish Family Services of Buffalo, and Max Donatelli, founding member of the Erie County Anti-Stigma Coalition and chair. Welcome, folks. It is really nice to have you here. And you know, the holidays can be a difficult time if you're suffering with mental illness, because I think people, and as you'll agree, Marlene, it's still probably the last stigma, isn't it, to talk about?
Yeah, I think that it's the last frontier. People don't want to talk about their mental health and stigma. People always equate it with somebody who's crazy running down the street, you know, without clothes, or, you know, shooting. So people don't want to talk about it because it's stigmatized. And I think that if we talk about it, bring it to the forefront, then people realize there's more than just one person who's got a challenge.
Max?
Yeah, and what we're really trying to do is we're trying to start a community conversation about mental health and about mental illness, and how important it is for people to recognize that there is, you know, with help you can get, you know, you can really do better, and there's hope for the future. And you know, but unless people are able to really talk about it, and right now there's such a stigma that's attached to it, we're really trying to, through our website and through the efforts we're making on social media, we really want to get this conversation going so that we're able to get more people to recognize, you know, from very young, you know, parents with young children all the way through to adults and even the elderly, where people just, you know, you wouldn't go for 10 years with, you know, with a broken leg, but people do go for years without getting help for their mental illness.
And Marlene, we were talking before the segment that this can start at a much younger age than you think, and it's not dealt with most times.
Right, because people are afraid if their children are having a challenge that other children won't play with them. And again, that's the stigma. I think, you know, this started because we were in a situation where we had to give a presentation. And so I asked, how many people in this room know somebody that has a mental health challenge? You know, everybody raised their hands twice. Then I said, how many people in this room have a mental health challenge? Nobody raised their hand. It's stigma. It's stigma.
Because we're saying even anxiety is a mental health challenge.
So one in five, according to the National Alliance of Mentally Ill, 1 in 5 people have a mental illness. So the chances are, you know, a friend, a family member, you know, will have some kind of a mental illness, and the only way to really do anything about it, of 40% of the people that have mental illness, you know, do get professional help, but the rest really don't. I mean, they really don't, and they may go for years without it. And it's so important to be able to get professional help or peer support or some kind of support, but you have to be able to recognize it first. And that's part of what we're trying to do, is to help to decrease or eventually eliminate that stigma.
And we want to let everybody know that there's a new website, letstalkstigma.org. And what will people find on that website?
They'll find a wealth of information about stigma and mental health. We also ask that people take the pledge. There's a site, a site where people can take the pledge and say that they're going to talk about stigma and demystify what those issues are.
Because, you know, it has to be so helpful to the person who has been suffering with this in silence for years to be able to talk with somebody and be open about this when they've kind of sheltered this their whole life. It's a whole different experience for them.
You know, when you talk about opening up and sheltering themselves, I tell people that I live with anxiety and depression. I run a mental health clinic. So if I can't talk about stigma, I don't know who else can. And so I think it's important for me to talk about my challenges. And as long as I receive the help that I get and, you know, take some of the steps to keep me, you know, level, then I think it's really important to talk about it.
And, you know, Max, I think this time of year, the holidays presents challenges, and that can also affect people who are already suffering with some mental health challenges.
Exactly, and I think that's part of the reason why I think that's really a nice opportunity that we can talk about this now, and you know, before the holidays, or you know, at this time where people many times that you know, you think that there's a lot of people that are very happy, and you know, family get-togethers and things like that, but people sometimes, you know, during the holidays go through some significant depressions because of potentially some traumatic events or some other issues that have been going on. And so this is a time where some people are really at risk.
Right, and you know, to go and to seek help is not an admission of failure.
Right.
Exactly.
It's actually an admission of success, because you want to work with somebody
That's right.
to work through this and to be the best that you can be and to be able to handle it.
Yes.
So as we also have crisisservices.org down here on our screen, because they of course have their 24-hour hotline, and their website is always available. The one that we want to talk about this morning, to have you understand, is letstalkstigma.org. A lot of good information there, and it really can help you. And there's always somebody there to talk to and to get a great referral. We have a wonderful group of people here who are caring in Western New York, who are willing to work with you and to help you as much as possible.